The Red Cross, a humanitarian organization synonymous with saving lives, once upheld racial segregation in its blood donation practices during a time when every drop of blood was crucial, where African American contributions were segregated, stigmatized, and undervalued. The painful irony surrounding all of this, Dr. Charles Drew, a pioneering African American physician who revolutionized blood banking and saved countless lives, was deeply tied to the Red Cross during this time. How could the work of a man who broke barriers in medicine and the blood contributions of countless African Americans be overshadowed by policies rooted in prejudice and pseudoscience? Stay tuned as we unpack this striking story of brilliance and bigotry.
You hear about blood drives all the time, right?
Yep.
They're everywhere. But did you know that during World War II, the American Red Cross, at first, they wouldn't take blood from African Americans?
It's a pretty stark contradiction, isn't it? We're talking about an organization that everyone knows for saving lives, but they had this policy that had no scientific basis and was clearly discriminatory.
Yeah, it's hard to believe that the person who made blood drives even possible was told he couldn't donate by that same organization.
It really goes to show how much racism was just built into the system back then. The idea that blood was different based on race was just completely made up.
Dr. Drew was a true pioneer in blood banking. Can you talk about his work a little more?
Sure. Dr. Drew's research focused on how to store and preserve blood plasma. Before his work, blood transfusions could only be done if the blood was used very, very quickly. But his discoveries made it possible to create blood banks, which were a game changer, especially during World War II.
I'm curious, how did his techniques work exactly?
Well, he found out that if you separated the liquid part of blood, which is the plasma, and then you refrigerated it, you could make it last much longer. And another crucial thing was that plasma can be given to people with any blood type, which made it a universal resource for emergencies. It was essential on battlefields where they needed to do transfusions immediately.
So while he was doing all of that, the Red Cross was refusing to take blood from Black Americans.
Yeah, when they started collecting blood for the military in 1941, they initially said no to blood from African Americans.
Wow.
The public really pushed back, and the Red Cross had to change what they were doing.
But they didn't just decide to accept all blood equally, did they?
Not exactly. They started segregating the blood donations and labeling the blood from Black donors differently. Can you imagine wanting to help with the war effort? You know, wanting to save the lives of American soldiers and then being told that your blood has to be kept separate? Like, it's somehow not as good.
So how did Dr. Drew react to this?
Well, he was completely against it. He knew the science, and he knew that this segregation was just nonsense. He called it out for what it was racist and harmful.
So he didn't stay quiet about it?
Oh, no, not at all. He spoke out publicly against it. He argued that it was wrong morally and scientifically. His actions helped to bring attention to this problem, but unfortunately, it didn't make the Red Cross change their minds right away.
It must have been so hard for him to be in that position.
It was, imagine being a brilliant doctor, a leader in your field, working for an organization that had policies that went against your work and your beliefs. It just shows how hypocritical things were back then.
And in the end, he decided to resign from the Red Cross, right?
Yeah. In 1942, Dr. Drew left his job as director of the first American Red Cross blood bank because he didn't agree with their policy of keeping blood donations separate. It was a powerful message.
Wow, that must have been a very tough decision.
He was putting his career and his reputation on the line, but he wasn't going to compromise what he believed in.
What were the consequences of this policy for Black soldiers who were fighting in the war?
Tragically, it put their lives at risk. There were cases where wounded Black soldiers needed blood transfusions, but they didn't get them because there wasn't any Black labeled blood available, or it had been thrown away because of this ridiculous prejudice. It's really sad to think about.
That's awful. Their own country fighting for freedom overseas, and they were being denied basic medical care because of the color of their skin.
It's a reminder of how deeply rooted racism was and still is in our systems, even in institutions that are supposed to be about helping people.
What did the Black press and civil rights leaders do about it?
They responded right away. Black newspapers like the Chicago Defender and the Pittsburgh Courier, they wrote editorials that were really critical. They called out the Red Cross and said this was just another example of systemic racism putting lives at risk.
No, they didn't hold back.
No, they couldn't. Civil rights leaders like A. Philip Randolph, who had already done so much to stop discrimination in defense industries, and the NAACP, they all joined in and spoke out against this. They knew this was literally a matter of life or death. They stressed how important it was to be united and treat everyone equally, especially during a war.
Did what they do have any effect?
They definitely put more pressure on the Red Cross, but sadly, it took years of activism and advocacy to finally get them to change.
So the segregation policy didn't go away immediately?
Nope. Even with all the public outcry, the scientific evidence, the moral arguments, it took until 1950, almost a whole decade after they started collecting blood, for them to finally stop officially segregating blood donations.
I can only imagine the frustration and anger African Americans must have felt, knowing that they were still being treated like they were less than.
It was a painful experience for sure, a constant reminder that they were treated as second-class citizens, even though they were sacrificing for their country.
It feels like a betrayal.
It was, and even though the policy eventually changed, the damage was done, it hurt people's trust in the Red Cross and the medical system as a whole.
So the impact wasn't just limited to that situation.
Right. It contributed to a deep distrust of the medical system among African Americans. And that distrust, unfortunately, is still around today and still has a negative effect on health equity.
It's all very upsetting. But I'd like to know more about what happened to Dr. Drew after he resigned. What did he do next?
Well, that's a story for our next installment. Dr. Drew's life didn't end with his resignation. That was actually just the beginning of a new chapter, a chapter filled with both great achievements and sadness.
Okay.
It's a story that has both incredible successes and deep sorrow.
All right, so tell us what happened to Dr. Drew after he left the Red Cross.
He went back to Howard University, which is a historically Black university in Washington, D.C. He became the head of the Department of Surgery there and kept doing his groundbreaking research.
So he kind of went back to his roots.
Yeah, and at Howard, he could really focus on training new Black physicians, which was something he was really passionate about.
He saw it as a way to give power to his community and fix the inequalities in healthcare, right?
Exactly. He knew that having more Black doctors was essential to improving healthcare access and quality for African Americans.
It sounds like his experience with the Red Cross didn't make him bitter or stop him from doing what he felt was important.
Not at all. It seemed to make him even more determined to make a difference. He kept speaking out for racial equality in healthcare. He talked at conferences and wrote articles about it.
He kept being an advocate even after he left the Red Cross.
Absolutely. He understood the influence he had, and he used it to try to change things.
Besides that, what were some of the other important things he did for medicine during that time?
Well, on top of his research and teaching, Dr. Drew was a key part of creating standardized procedures for collecting and storing blood.
So he was still shaping the very field that treated him so unfairly.
He was, and his work continued to have a global impact, saving lives in the United States and all around the world.
It shows how brilliant and dedicated he was.
Yeah, he could have easily become disillusioned after what happened at the Red Cross, but instead he put even more energy into his work in medicine and for his community.
It's a really powerful example of resilience and perseverance.
It is. Dr. Drew's story shows us how the human spirit can overcome difficult things and use setbacks to create positive change.
It's amazing that he had such an incredible career making these groundbreaking contributions to medicine training a new generation of Black doctors and fighting for racial equality in healthcare. It's sad that his story isn't more well known.
It is a shame his achievements should be celebrated, and his story should be told. It's a reminder of how brilliant and resilient Black Americans are, especially when they face so many obstacles.
And it reminds us of how racism is still a problem in this country, even in areas like medicine where people's lives are at stake.
Exactly. It's a story that makes us think about the uncomfortable truths of our past and how we need to keep fighting for fairness and justice today.
Unfortunately, Dr. Drew's life was cut short. Can you tell us what happened?
It's a very sad ending to a remarkable life in 1950 when he was just 45 years old. Dr. Drew was driving to a medical conference in Alabama when he got into a bad car accident.
He was so young.
He was, and he was seriously injured. He broke his leg and his neck. They took him to a hospital nearby, but even though the medical staff tried their best, he died a few hours later.
That's so sad. I heard there were rumors that he was denied treatment because he was Black. Are those rumors true?
That question has been around for a long time. At first, some reports said that Dr. Drew wasn't treated at a white hospital, and that made a lot of people angry and started a lot of speculation.
Given what things were like back then racially, it's easy to see why those rumors spread.
Yeah, and while there's no proof that he was denied treatment because of his race, the fact that those rumors persisted says a lot about the distrust and fear that existed at that time.
It reflects what life was like for Black Americans during that era, the constant threat of discrimination, even when their lives were in danger.
It highlights the lasting effects of segregation and how racism was everywhere.
How did people react when Dr. Drew died?
It was a huge loss, not just for the medical world, but for the entire country. People mourned him as a brilliant doctor, a dedicated teacher, and a tireless advocate for racial equality.
It must have been especially devastating for the Black community.
It was Dr. Drew represented hope progress, the possibility of Black excellence. His death was a terrible blow, a stark reminder of how fragile life is and the challenges they still face.
His story reminds us that progress isn't always straightforward, and that even when there are victories, there are setbacks and losses along the way.
Yeah, it shows us that the fight for equality continues, and each generation has to pick up the torch and keep going.
And to you listening, we hope this has made you think about the life and legacy of Dr. Charles Drew. His story shows us that one person can change the world, and reminds us that the fight for justice and equality isn't over. Let his story inspire you to make a difference, to speak out against what's wrong, and to work towards a world where everyone has the chance to thrive. Thanks for joining us.